Order. I now call Secretary of State for Health and Social Care to make a statement. Secretary Hancock.
Thank you very much, Mr. Speaker. Mr. Speaker, as we enter the coldest months, we must be vigilant and keep this virus under control. Yesterday, 25,161 cases were reported, and there are 18,038 people in hospital with coronavirus in the UK. We must keep suppressing this virus. And this isn't just a matter for government or for this House, it's a matter for every single person. And these are always the most difficult months for people's health and for the NHS. And especially with the vaccine already here, we must be cautious as we accelerate the vaccine deployment, as per the winter plan. We've come so far, we mustn't blow it now. Mr. Speaker, when we reintroduced the tiered system, we resolved to review the data every 2 weeks in each area. The sophisticated COVID surveillance system we now have in place means that we can act swiftly and decisively when needed. At the weekend, we held an emergency review for London, Essex, and parts of Hertfordshire, where cases are accelerating fast. Yesterday, we held the first formal review, and I must report to the House that across the world, cases are rising once more. In Europe, restrictions are being reintroduced. In America, case rates have accelerated. In Japan, cases are rising once again. Yesterday, the Welsh government made the decision to tighten restrictions across the whole of Wales. No one wants tougher restrictions any longer than necessary. But where they are necessary, we must put them in place to prevent the NHS from being overwhelmed and protect life. Mr. Speaker, even in a normal year, this is the busiest time for the NHS. As Chris Hopson, the Chief Executive of NHS Providers, reminded us this morning, controlling infection rates is about limiting patient harm. And this is a moment when we act with caution. In the southeast of England, cases are up 46% in the last week. Hospital admissions are up by more than a third. In the east of England, cases are up 2/3 in the last week, and hospital admissions are up by nearly half. It is therefore necessary to apply Tier 3 measures across a much wider area of the east and southeast of England, including Bedfordshire, Buckinghamshire, Berkshire, Peterborough, the whole of Hertfordshire, Surrey with the exception of Waverley, Hastings and Rother on the Kent border of East Sussex, and Portsmouth, Gosport and Havant in Hampshire. These changes will take effect from 1 minute past midnight on Saturday morning. And I know that Tier 3 measures are tough, but the best way for everyone to get out of them is to pull together, not just to follow the rules, but do everything they possibly can to stop the spread of the virus. Where we've seen places get the virus under control and come out of Tier 3, it's where everyone has taken responsibility on themselves to make that happen. We've seen case rates fall across large parts of England, and I know that many places in Tier 3 have seen their rates reduce. In most places, I have to tell you, Mr. Speaker, we are not quite there yet, and the pressures on the NHS remain. But we are able to move some places down a tier. We assess these decisions according to the 5 published indicators: case rates amongst the over 60s, test positivity, rates of change, and hospital pressure. And today I'm placing in the Library of the House an assessment of each area and publishing the data on which we make these decisions. For the vast majority of places currently in Tier 3, we're not making a change today. However, Mr. Speaker, I am pleased to say that some places can go down a tier. In Bristol and North Somerset, rates have come down from 432 per 100,000 to 121 and falling. And I can therefore announce that Bristol and North Somerset will come out of Tier 3 into Tier 2 on Saturday. Rates in Herefordshire have also come down to 45 in 100,000 and are falling. And we can therefore bring Herefordshire out of Tier 2 and into Tier 1. I want to pay tribute to everyone who's been doing the right thing and getting rates down, whether or not your area has come down a tier today. It's so vital that everyone sticks at it and does the right thing, especially over this Christmas period. And it's important to remember that this can be a silent disease. 1 in 3 people who has the disease has no symptoms but can still pass it on. Everyone, therefore, has a personal responsibility to play their part in keeping this pandemic under control. I know that other areas are so eager to move down tiers, and the best thing we can all do is act with responsibility to get the virus under control. Mr. Speaker, these restrictions are thankfully not the only tool we have now to fight the disease. We're further expanding our testing programme, and later today the Education Secretary will set out further action on school testing in the new year. And of course, the vaccine rollout is accelerating. I can update the House that over 200 vaccination sites are now open in all parts of the UK, with more opening their doors and bringing hope to communities over the coming days. And I know that everyone will be as thrilled as I am every time they're contacted by a friend or a loved one getting the jab. It was a wonderful sight to see the global map of vaccine deployment, with the UK proudly standing out as the site of the first vaccinations. It's a huge logistical challenge, but the vaccine offers us promise of a better year ahead. And until the great endeavour of vaccine deployment reaches enough people to make this country safe, we must keep doing what it takes to protect our NHS and protect those we love. That means all of us doing our bit, following the rules and taking personal responsibility to help contain the spread of the virus, so we can get through this safely together. And I commend this statement to the House.
I now call the Shadow Secretary of State, Jonathan Ashworth.
Well, Mr. Speaker, and I thank the Secretary of State for advance sight of his statement. These past 12 months have seen COVID spread with speed and severity. Over 65,000 have died in the United Kingdom, at least 620 of them health and care workers, making the ultimate sacrifice in the line of duty. Over 240,000 have been treated in hospitals with the disease. And as the Secretary of State reminded us, what gives this virus such lethal advantage is that people who appear healthy can go about their lives unaware they are transmitting the virus to others. So, of course, we accept and understand why he's had to move areas into higher tiers today, even though this means tens of millions of people across England are now living under the toughest restrictions. And we're grateful that he's placing in the library details on each of our local authority areas. But 2 weeks ago, he did say that we have the virus under control. And he also said we can't risk letting cases rise again, especially into Christmas. But I'm afraid that is exactly what is now happening, isn't it? Yesterday, England reported over 23,000 cases, the highest numbers in a month. Hospital admissions on 14th of December were the highest since 16th of April. The number of people in hospital with COVID is now the highest since the 22nd of April. The number has risen 20% since the end of lockdown. If it goes up by another 20%, we are back at the same peak we saw in April. These numbers should be sounding all the alarm bells there are, and it's why clinicians are pleading with him to put robust arrangements in place to keep people safe through Christmas. We saw in Canada and in the US huge spikes in infections following the Thanksgiving. We will see a spike here. This isn't about cancelling Christmas. Santa will still deliver his presents. But is he really telling us that allowing indoor mixing of 3 households across regions and generations for 5 days is sensible, given the virus is raging with such ferocity at the moment? And the devastating tragedy is that those who will be most impacted by this virus spreading through the easing are those who will be at the front of the queue for the vaccine in the next month or two. So will he look again at the Christmas arrangements? On vaccination, and with more than 130,000 vaccinated in the first week, that is a good thing, and we celebrate and we congratulate all involved. But to vaccinate every older person, vulnerable person and key worker by Easter, we'll need to do something like double that every day. The National Audit Office this week said 11.7 billion for the programme will be needed, alongside 46,000 extra staff. So how much is actually allocated to the vaccine programme at the moment? And how many staff have been taken on and trained to support the vaccination programme? And when will we see the mass vaccination centres opened in our constituencies? There have also been warnings today about vaccine rollout in primary care taking longer than planned because existing software systems keep crashing. The system doesn't alert GPs if a patient on their lists has already had it in the hospital, and GPs are forced to turn to pen and paper for data capture. So when will there be a national call and recall system for GPs, and why wasn't it ready for the rollout this week? He mentioned the Secretary of State for Education is to make a statement on schools. I don't know if that means he's coming to the House or not, but with schools going back in January, can he provide some clarity around testing in schools? Because there is some speculation that the opening of schools will be delayed by a week in January. Could he give us an update on what is happening on that front? Finally, Mr. Speaker, Madam Deputy Speaker, this has been a dismal year for our national health, for all of us, but our National Health Service workers and our care workers have, as always, done us proud. So can I put on record my thanks to all of them, many of whom will be working through the Christmas and New Year period. And can I also thank all those working on the response to COVID, his departmental officials, our medical science community, our public health teams as well. And with that, can I wish you, Madam Deputy Speaker, and all working in the House, and indeed the Secretary of State, a safe Christmas and a happy New Year.
Secretary of State.
Thank you very much, Madam Deputy Speaker. Well, the honourable gentleman rightly asks about the arrangements in place for Christmas, which the Prime Minister set out yesterday very clearly. Christmas is a very special time of year, and that's why we've put in these arrangements that we have. And it is a matter of people's personal responsibility to ensure that they act and they see their loved ones in a way that is safe and careful. And I think people understand that. And what's more, I think people will abide by it. We know that it is safer to see older people, especially if they're over 70 or clinically extremely vulnerable, if you've taken the care to reduce social contact beforehand. And we also know that after Christmas, being able to reduce social contact will be important for keeping this under control. And I think that aspect of personal responsibility is important. Sometimes in this House, it feels to me like the debate is as if we don't in government put in place concrete rules, then nobody will take any action. Actually, it's down to individuals, each and every one of us, to take responsibility for our actions within the rules, of course, but also being cautious. This is a massive team effort, and it is my experience of the last few months, is that when a community has come together to get case rates down, that is when it has happened and when it has worked. And even with the rules in place, it is only when the community essentially comes together to get this under control that you get the cases coming down and the pressure on the NHS. I regret having to take the action that we have to take. I deem it necessary, and there's a strong view right across government that these actions are necessary. But I also plead that personal responsibility is absolutely central to how we as a society should respond to this pandemic. He asked about the mass vaccination rollout. The mass vaccination sites are appropriate for the Oxford AstraZeneca vaccine, should that come through and be approved by the regulator. And so it is some weeks until we'll see those rolled out. However, we are every day having more and more primary care sites coming on board with the rollout of the Pfizer vaccine. And it's very good to see that happening, and I expect the numbers that are vaccinated to accelerate. The team have made a very, very good start, and there's a long way further to go. He asked about the data systems. The data systems have very largely been working very effectively. Of course, any very large logistical rollout like this has niggles, but they are small and been brilliantly dealt with locally on the ground. He asked about the rollout of testing in schools. As I say, the Education Secretary will set out more details about offering all secondary schools, colleges, special schools, and alternative provision settings the help, support and facilities to test as many secondary age and FE students as possible as they resume their education in January. And I thank in advance all of the work of teachers and support staff in schools who will no doubt lean in and support this task to make sure that school return can be done as safely as possible. And finally, may I echo the words of the honourable member and wish him a happy Christmas and a safe Christmas, and I look forward very much to seeing him again in January.
And now we go to the chairman of the Select Committee, Jeremy Hunt.
Thank you, Madam Deputy Speaker. In the last week, I've received unexpectedly joyful emails from residents of South West Surrey who have been amongst the first in the world to receive a clinically approved vaccine for coronavirus. So can I thank him for that early Christmas present, and also thank him for the energy, the endless media rounds, and the dedication that he has shown in the last year, which must be one of the toughest imaginable for a health secretary. And I'm also grateful that Waverley has been excluded from the Surrey-wide move to Tier 3 in recognition of our lower infection rates, although we will remain vigilant. I want to ask him about Christmas, just a week away. Of course, personal responsibility matters, but in a pandemic, so does clarity. So irrespective of the law or the regulations, should we or should we not have indoor social gatherings with elderly and vulnerable family members?
Madam Deputy Speaker, people should act with great caution. People should act with great caution in this pandemic because it protects them, it protects their families, it protects their loved ones. We've set out what the rules are, but they are not a limit up to which we should all push. We can all act within those rules to limit the spread. And by reducing social contact in the days up to meeting a family member who may be, for instance, over 70, or any other family member, it is reasonable and responsible to take that sort of action. I'm very grateful for what he said about the vaccine rollout. That it is. I've been cheered by messages I get from constituents and others now that they're receiving the vaccine, and we've just got to make sure we get this deployment out as fast as the vaccine can reasonably be produced, and as fast as the NHS can deploy it, so that we get people the safety of that vaccine, and so we can get through this and out of this as soon as possible.
Now we go to Scotland, to the SNP spokesman, Martin Day.
Thank you, Madam Deputy Speaker. It is important that the festive days ahead do not become a 5-day mass get-together. Therefore, we should use as little of the flexibility as possible, spread over several days, while ensuring that no one is facing Christmas alone. The concerns from medical professionals that the Christmas COVID restriction relaxation will cost lives are not to be dismissed lightly. And would the Minister agree with me that if people are to form a bubble, that it should be kept as small as possible? And if so, would it not be better to follow the Scottish approach, which sets a strict maximum limit on the numbers of up to 8 people from 3 households, rather than the potentially unlimited numbers permitted currently in the English bubbles?
Well, this has been an incredibly difficult year for so many people and for so many families. And the fixed numerical limits have a particular burden on very large families. And so we have taken, I think, a balance and the right approach. But, Madam Deputy Speaker, I understand the urge for caution. Of course, I understand that from my NHS colleagues and others. But, Madam Deputy Speaker, I also understand that people want to see their children, people want to see their loved ones. And Christmas is an important time of year, and we've got to find balance.
Sir Bernard Jenkin.
Thank you, Madam Deputy Speaker. And may I join with my right honourable friend in wishing our NHS staff and everyone in this crisis a happy Christmas. But would you also join with me in wishing the Essex County Council and local authorities in Essex a happy Christmas, what they're now contributing to the test, track and trace operation since the NHS Test and Trace started to share data much more quickly with local authorities. Can I report to him that most districts have now started door knocking to follow up contacts and cases, and the complete case and contact rates are now around 87% and 90% respectively. Would you join with me in congratulating local authorities in Essex on this tremendous effort?
My right honourable friend is absolutely right, and I'm grinning because I think this is the first time of the dozens and dozens of statements I've done this year when the honourable member opposite hasn't mentioned track and trace. And I'll tell you why, Madam Deputy Speaker. It's because the latest statistics show that where communications were available, 96.6% of people were reached and told to self-isolate. And that's because of the huge improvements in contact tracing and in testing that have been delivered this year, including, of course, with local authority partners, but also with the brilliant national NHS test and trace system, which we should all congratulate. I think that getting those contact rates.
Order. This is not a moment for shouting. Listen to the Secretary of State. Secretary of State.
I think the moment when we see contact rates over 90% should be a moment when everybody should come together and say thank you and well done to everybody at NHS Test and Trace and all of their partners, whether they're in the public sector or the brilliant private sector partners who we all support.
Now we're going to Bradford, to Judith Cummins.
Thank you, Madam Deputy Speaker, and happy Christmas to you and yours. The Secretary of State will know the significant effect the pandemic has had on NHS dentistry. There is a backlog of more than 19 million appointments. It is therefore shocking and unacceptable that NHS England has just decided to impose a new activity target on dentists in England, which many will simply not be able to meet under new COVID restrictions. NHS England's own data shows that nearly 60% of dental practices will be hit with severe financial penalties. Dentists will now need to prioritise checkups rather than dealing with a backlog of patients needing treatment. Others may be forced to close entirely. A straight choice between staying financially viable or treating those in pain with more complex problems. Will the Secretary of State reverse this decision, which threatens patient safety and access and could lead to the demise of NHS dentistry